Hi everyone, this is Dr. Han's office and today's topic is diabetes. First, I'm going to introduce you to the dangers associated with diabetes. Diabetes can cause cataract, but it won't lead to lifelong blindness because there is a surgery for artificial eyelids. You can see the comparison of the eye with cataract on the left and the normal eye on the right. Diabetes can also lead to diabetic retinopathy. This picture shows a normal retina. It's very clear. This one is a mild retinopathy. There is a small amount of white dots on the retina. And the last picture shows a severe retinopathy with lots of white dots on the retina. Diabetic retinopathy can lead to lifelong blindness. Therefore, diabetic patients need to visit ophthalmologists every year to have their eyes checked. If the examination results shows a severe retinopathy, ophthalmologists will provide a treatment using laser photocoagulation technique to prevent retinopathy to spread to the whole eyeball. Other than eyes, diabetes can also cause heart disease. Diabetes can cause vascular occlusion and blood circulation system will also get affected. Thus, diabetes patients are more likely to expose to heart disease like myocardial infarction and etc. The feet are the furthest body part from the heart. Therefore, your feet will be severely impacted due to no blood circulation to your foot. To prevent diabetic foot care is required every day. First, your feet have to be cleaned every day with warm water. Second, check if your feet have a new scar or change in color. Third, if there is any change with your feet, contact your family doctor immediately for diagnosis to prevent the situation to get worse. Vascular occlusion due to diabetes will cause damages to your brain and will lead to stroke. Once you have stroke, you will need a lifelong assist from others and sitting on a wheelchair. Similar to eating candies, the sugar level of diabetes can seriously damage mouth and gums. Patients are required to brush their teeth every morning and night to develop good oral hygiene habits. Also, control how much sugar you consume and visit dentists frequently. Diabetic nephropathy is one of the most important complications of diabetes. A majority of people who perform dialysis are diabetic patients. Diabetes will cause the renal tubule to be hardened and result in kidney failure. Lastly, we know that diabetes can cause damage to different parts of our body. And to prevent these damage, have your eyes checked at least once every year. Have your heart checked by your family doctor at least once a year. And every day check your feet to see if there are any changes. If there are changes, see a doctor immediately. Stroke is a serious problem that needs constant attention. Guarantee a good oral hygiene to prevent oral disease. A kidney function test is required at least once every year to prevent kidney failure. Ways to check if you have diabetes. Every time when you have a blood examination at your family's doctor's office, doctor will also check for a level of hemoglobin A1C in your blood to see if you have diabetes or not. Different from normal blood sugar level, hemoglobin A1C shows the average glucose level for the past 3 months. More accurately diagnose if you have diabetes or not. When you go to your doctor's office, doctor will not only test your blood sugar level. Your microalbumin will also get tested to make sure your kidney have not yet get damaged by diabetes. Diabetes often leads to kidney failure. Due to the need of dialysis, if doctor discovers microalbumin level abnormalities early, the doctor will prescribe medicine to protect kidney function and control your blood sugar level. Next, we will show you a short video clip on how to use the glucose meter. First, open the package. The package contains a glucose meter, a blood collecting pen, needle, and an alcohol wipe. Before we start testing, we first prepare the blood collecting pen, and to do so, we remove the cap from the pen and place a needle into the pen. After you place the needle into the pen, take off the cap on the needle by twisting to the right. Then put the cap back on for the blood collecting pen. To complete the preparation for the pen, make sure to pull the end of the pen upward until a click sound is heard. Now we need to prepare the glucose meter. To prepare the glucose meter, you'll need a glucose test strip. Take out a test strip from the bottom and place the side with the marking in the slot in front of the glucose meter. Wait until there are numbers appearing on the screen to fully complete the preparation for the glucose meter. Now to test for the glucose level, first wipe your index finger with an alcohol wipe. Collect blood by placing the blood collecting pen on the fingertip and push the button until a click sound is heard. Then put the cap on for the blood collecting pen. Since this is just to show you how to use the glucose meter, I will not use the blood collecting pen on my hand, but I will use a blood sample and pretend that it is my blood. Now to collect the blood from your fingertip, use the side of the test strip that was inserted into the glucose meter to collect the blood. When your blood comes in contact with the testing paper, wait 5 seconds and the screen will show your glucose level. Right here, we can clearly see that the glucose level is 103. After testing, wipe your fingertip with the alcohol wipe and remove the test strip from the glucose meter and dispose it into a disposable container. Then remove the cap from the blood collecting pen and put the cap for the needle back on and pull out the needle from the pen, and also dispose it into a disposable container. Don't forget to put the cap back on for the blood collecting pen. Now we have completed the steps on how to use the glucose meter. Once you realize you have diabetes, you should start to control and reduce the dangers of diabetes. 3 basic ways to control are: first, start having a diabetic diet. Second is to exercise. And third is to take medication. Some things to remember when taking medications for diabetes are: stop taking medicine when your glucose level is too low. Drink plenty of water and stay hydrated. When visiting dentists, surgical doctor, and other doctors, tell them that you are taking diabetes medications. Measure glucose level twice a day. First measurement will be taken when empty stomach for 8 hours, and the second measurement will be taken 2 hours after a meal. And lastly, follow the instructions given by a doctor when you exercise and eat. How to consume the diabetes medication. You can take the medicine solely or taking it together with other diabetes medicines. You can also take the medicine before or after a meal with water. For more information, you can contact your family doctor. Thanks for watching. If you have any questions, feel free to contact us.